Thank you, everybody, for hanging around on this beautiful day. Again, Joel Babbitt with the association. I want to touch on retirement healthcare funding. I'm going to first spend a second because a few people have come up and asked us about, are we going to touch on the limits on deferred comp along with in-plan Roth conversion? So I'm going to touch on it real quick. For those that are currently active employees, this is the limits this year that you can put into your deferred comp plan. If you're under the age of 50, so you're not turning 50 this year. So my birthday is December 31st. The January that I turn 50, I could use the age 50 catch-up. The limit's $23,500. January of the year you're turning 50, the limit right now is an additional $7,500. What you'll see on the screen is something new for 2025. They have this brand new age 60 catch-up. So hopefully for all our safety people, it's something you'll never experience. But because you're long gone by then, and retired meaning long gone. But for me, who turned 60, if I can afford it, I can do $34,750. There's also the alternative catch-up, which allows you to double down for up to 3 consecutive years. If you're Article 3 and 4, you can start at the January of the year you turn 47. If you're Tier 2, Article 3 and 4, you can start at age 52. Okay, and so just to give you an idea, you can double down potentially to $47,000. You cannot use the age 50 in the alternative in the same year. Illinois is one of 4 states that has an income tax but excludes retirement plan distribution. So it's Illinois, Pennsylvania, Mississippi, and Iowa. Michigan will be there in 2027. What that means is that they have an income tax. Illinois charges 4.95%, but what do they not tax? And don't say nothing because you all know better. They don't tax your pensions. They don't tax your deferred comp. They don't tax your spouse's IRAs or 401ks or 403bs. All retirement plan distributions come out tax without any taxes to the state of Illinois. You still owe federal, but you don't owe any state income tax if you're a resident of Illinois. What you can do inside your deferred comp plan or your spouse's retirement plan, their 401k, or my wife has a profit sharing plan, is you could defer pre-tax, convert it within your account. And so for our deferred comp plan, it is a simple 2-page, it's actually 3 pages now, a 3-page form that allows you to take any sort of money that you've put in pre-tax, convert it to Roth, and you don't pay any state income tax on that money. And so there's a bunch of rules on the Roth that are different than the pre-tax. The Roth, you have to be 59 and a half to touch. Pre-tax, it's separation of service. And also, the first Roth deposit has to be 5 years old. So just some tips. With the 457, defer as much as you can as you're walking out the door pre-tax, because you can take it right out the day you separate service and you don't pay any state income tax. The other thing you can do is put it in there and convert it. So if your household income is between $80,251 and $171,000 and you convert 20 grand, you're going to owe about $4,400 in income taxes to the federal government. So when you start playing with it, this is me. So from January of 2011 through the end of last year, where I turned 60 last year, December 31st of last year, I turned 60, I was doing in-plan Roth conversions, and I was doing it about every pay period. We have people that do it once a year. I've got some team members that do it once a quarter. But about every pay period, I submitted a form, I stuck money in, and then converted it within my account. So from January of 2011 through the end of last year, I've been maxing out, converting it as I went along, and I've saved $15,772 in state income tax. So you add up the total contributed column, multiply that by 4.95, I would have paid $15,772 in income tax in the state of Illinois if I just made a Roth contribution. But because I did it within my plan, I stiffed the state of Illinois. Thank you, Illinois. That additional $15,772 in my account, and I've got an S&P 500, that's a lot of it sitting in. I do have other money invested, it's in growth portfolios, but you could see it turned into an additional $35,000 to almost $36,000. So by just paying attention to the tax code, and if you're someone who's just doing a Roth IRA and not taking advantage of some of these in-plan Roth conversions with your vendor or with your deferred comp or your 401k or whatever it may happen to be, or with my own children who are in state, I'm encouraging them to put the money away pre-tax and convert it because you save the state income tax. It's a little something, it all adds up. And the catch is for all that money I converted, so last year I converted $30,500, you end up getting a 1099 for $30,500. So I went to my payroll and said, hey, withhold an extra $200 a check for Fed. So I about had it covered. So it's just something you can do. Stop down at the table downstairs. We're happy to talk to you about it. So the rest of what I want to talk about is this thing called retirement healthcare funding, which I know many of you have heard me talk about before. And there's always some changes going on with it. But as we're out in the field working with people and employers, what we're seeing is there's just a drought of recruitment going on. There's a lot of vacancies out there. People are really struggling. Where I've been involved in the association since 1995, and I remember in the early 2000s, we'd be in a police roll call doing a deferred comp meeting, and they would be talking about there were 300 applicants for 5 jobs. And today you're lucky to get 12 people to show up for 3 jobs, and half of those 12 don't pass the psych exam. And so you got a lot of vacancies out there, and what's going on is they got a lot of people that ended up not saving for retirement. So you got this guy or this group of people that are still on the rig today, or this gentleman still working. They should be here or here, but definitely not here. So we were in Traylor Estates, Florida. We pulled up to the firehouse to sell them deferred comp. This thing is sitting out in front of the firehouse. One, I didn't know they made boots that small. Number 2, I thought to myself, me going, this poor guy ran out of money because healthcare was running him too much. He couldn't afford his association dues, his HOA dues. We know that death and taxes are a certainty in life, and we also know you got to pay for healthcare. So can anybody tell me what percentage of your check, for those that are still working, I see a lot of retirees in this crowd, how much are you paying for Medicare? What comes out of your paycheck for Medicare? What's that number? I think I heard somebody say 1.45. So from the time you started working in that ice cream shop as a kid in high school, you've been paying 1.45% of your salary into Medicare, and your employer's been matching that all along. So you basically put in 2.9% of your lifetime earnings into Medicare. And so there's this misconception that Medicare is free. And the funny part of the misconception is, and think about best practice. What was best practice 20 or 25 years ago? This is 1924 Tour de France. Best practice was to smoke because they thought smoking helped expand lung capacity. It's crazy. These guys are smoking while they're riding their bikes. Best practice. So by the time you turn 65, if you've had $3 million of lifetime earnings, you've already paid in $87,000 into Medicare. And so there's a bunch of studies. I'm going to run through a few of them right now. The first one's called EBRI, which is Employee Benefit Research Institute. And if you and your spouse are 65 on January 1st of 2024, how much money do you need in the bank on January 1 of 2024 to have a 90% certainty of meeting your healthcare needs on Medicare? And so what they're saying is the female's going to live about 21 years. She needs $217,000. The male's going to live about 19 years, and he needs about $184,000. So if you are married and you're both 65 on January 1 of 2024, EBRI says that you need $401,000 in the bank after tax the day you turn 65 for Medicare. Medicare Part B premiums have gone up 6.7% annually since 2018. Has your COLA on your pension done that? No, it has not. The U.S. Department of Health and Human Services says that 70% of us are going to need some healthcare needs in retirement. Everyone here has a pension. Medicare doesn't cover long-term care. Medicaid does. You'll never be poor because you have a nice pension, and thank goodness, okay? Because you've worked hard for that pension. So that's an out-of-pocket expense that a lot of people don't anticipate. Fidelity does a comparable study to EBRI. Fidelity's number for a male and female is 330,000. The difference between EBRI and the Fidelity number is the EBRI number is a bogey of about 90%. Fidelity's bogey is about a 75% chance of having enough money. So Milliman is another company out of Minneapolis, Minnesota, and they do all these studies. And they did this retiree healthcare cost index, and they did a very similar study to both EBRI and Fidelity. And so your total spend once on Medicare, if you're a male, going to live 19 years, your total spend is about $281,000. That's your expected out-of-pocket on Medicare. A female's $320,000. And that's on traditional Medicare, buying the Medicare supplement in Part D. If you go to a Medicare Advantage, your needs is less because the Medicare Advantage, it's a more restrictive network, but it's a lot more generous of a benefit, so your out-of-pocket is less. And you can see they estimate what the savings need is. The 188 and 207 is 395. So you get a bunch of different numbers, but going back to the last slide, it goes from about 330 up to 401. Millman's number is about 395. So the other thing that was of interest is that they're running a long-term analysis, and they do this every year. So that number's gone from 371 to 395 in just 3 years. Let's hope it starts to moderate because the cost of Medicare is getting quite bad. It's just a big number. And so we know that the COLA doesn't do this. For those that have Social Security, your Social Security COLA doesn't do this. And think about for Tier 2, what's the COLA on Tier 2? It's half a CPIU. And so if you happen to be a Tier 2 person, hypothetically, let's say you worked a full career and you retired in 2015, your COLA was basically non-existent from 2015 through 2024. So the reason why this adds up to be so much is these are all the things that Medicare doesn't cover. So you've got prescription drugs, you got to buy Part D, long-term care, deductibles and copays, most dental care, notably dentures, vision care, cosmetic surgery, medical marijuana, that will hopefully change at some point, and then medical care outside the U.S. So we hear frequently, hey, I'm moving to Costa Rica. Well, Medicare doesn't cover you. So one of the reasons why this adds up so much is this gentleman happened to be my wife's Uncle Al. He was a medic in World War II. He was stationed at a German POW camp because they were saving the medics for the invasion of Japan. And he was in Washington, Tacoma, Washington, as they were preparing to invade Japan when they started dropping the atomic bombs. And so he ended up finishing his naval career on a troop transport ship and on a hospital ship on the West Coast. He died Q1 of 2023, or maybe second quarter of 2023. He was in a nursing home in Deerfield, Illinois called Gidwitz. It was running $296 a day, basically $9,000 a month or $108,000 a year. He was in there from about 91. It was assisted living, 91 to the age of 97. That's a lot of money over those years. And he sold clothing over his lifetime. I don't understand how he accumulated so much money. I'm assuming maybe some of his children helped him out. But basically, it's a big out-of-pocket expense. And then Aunt Bertie, which was Aunt Roberta, during her final 23 months of life, he couldn't help take care of her. So he had to get somebody else into their apartment. So that was an additional $2,500 a month. The average for an assisted living facility is about $5,000 a month, inflating at 3.51. And if you need memory care runs about $11,000 a month in the Chicagoland area. It's just, all this is expensive. So why am I going through all this? Because this is what we're experiencing with our stakeholders. So you collectively retire prior to Medicare. So you've got to fill a gap, and what we hear is people are looking to fill a gap from the time they retire in their early to mid-50s until 65. That's actually the smaller the numbers you got to fill for. But here's our experience on pre-65 retirees. Medical or pre-Medicare premiums. So you stay on your employer's plan that you're retired out of. We on average see premiums running between about $700 a month and about $4,400 a month. The $4,400 a month is Berwyn family premium. You're retired out of Berwyn. You have a family coverage on the PPO. It's $52,000 a year to stay on that plan. It's a staggering amount of money, okay? Those healthcare premiums are coming out of your pension check after tax. So that's our experience. Last year as an organization, we paid 11,590 claims. I think that's what the number was. It was 9.2 million in reimbursements to our stakeholders. And so we have a lot of people that are utilizing these plans, and it's primarily they've put money aside because if you look at a pension check, that about 40 to 50% of a pension check is gone just between taxes and health care. So if your pension is, let's say your final salary is $100,000, you can multiply or divide this number. 75% pension, you get $6,250 a check a month. Not bad. They withhold federal taxes. From there, you're down to $5,000. If your premium is $1,500 a month. So when we look at premium reimbursement for a party of two, $1,500 is about our average number right now. Your check is down to $3,500. You've not made a college tuition payment, maybe a utility bill, maybe home repair, whatever it may happen to be. You may have a child getting married and you want to be spending some money on them. So there's a significant portion of a check that goes away just between taxes and healthcare. I'm also assuming you're in one of those no tax states like Illinois, Pennsylvania, Mississippi, or Iowa, that they don't tax retirement plan distributions. Or it could be you're in Florida or some other non-tax state. So our experience is that from 2001 to 2020, we basically had no inflation. It averaged 1.91%. COVID came about, inflation went way up. It has now come back down. Medical insurance premium inflation over the same period of time has run between 2.5 and 3 times the consumer price index. And so from the 2001 to the 2020 number, inflation was 1.91, healthcare inflation averaged 5.27. We're seeing it finally starting to return back to those norms. So if you retire at 55 and your premium is $1,500 a month with 5.27% healthcare inflation, you are going to incur $230,000 in premium from 55 to Medicare. So if you're using your deferred comp plan, you need about $287,000 in your deferred comp plan to net the $230,000. So, hang on. Sorry, touchy mouse. So basically, the way the math has always worked out is from 55 to 64, you need about $287,000. You need $330,000 to $401,000 for Medicare, so you just need a lot of money. And so it seems overwhelming, but what I'm going to walk through is it's not as overwhelming as what it may seem. So how much do I need to have saved by the time I'm 55? Because at 55, you're no longer saving. So you're putting money away over a period of time. At 55, you're going to retire, and now you've got all this medical you have to pay for, stuff that you've historically paid very little for. So read the small print, if you can. It assumes a 7.5% annual return, and I'm assuming you're going to save from the time you're 31 to 55. So you're going to save for 25 years. Okay? So you need to save from the day you turn 31 years old between $213,000 pre-tax or $266,000 just to have enough to cover premiums from 55 to 65. Because you know you need $287,000, but if you save it over a period of time, it's not going to cost you as much. Then you need a chunk for Medicare. And so you need to save, by the time you're 55, between $400,000 and $500,000 to get to where you need to be. So if you start looking at the math here, assuming on the rate of return, and I'm going to walk through what these retirement healthcare funding plans do, is that if you average 7.5% return over the course of your life, over your working career, you need to save about $296 a check. If you can do that from the time you're 31 to 55, you're in pretty much great shape. If you use a retirement healthcare funding plan because you're laundering money, and I'm going to go through that, you only need to save $222 a check. And the reason is because these plans, the money goes in tax exempt. It grows tax-free and it comes out tax-free. So for those, everyone here knows Medicare. Anybody here was covered by Social Security? Couple hands. So it goes in pre-Medicare. It also goes in pre-Social Security. So it saves the employer the match as well. So the money goes in tax-free, grows tax-free, and it comes out tax-free. That $9.2 million that we paid out on those 11,590 claims last year was tax-free. There was no 1099 on any of that money. The catch is the money can only come out for qualified medical expenses, including premiums. That's your catch, okay? So again, the money all goes in completely tax exempt. So what can you use this account for? You've got this pile of money. You get to reimburse yourself for all qualified medical expenses, including premiums. It can be co-pays, deductibles, dental, vision, chiropractic, co-insurance, and the big ones that we see are premiums. Of those 11,000, whatever number it was, 529, whatever it was, of those claims, the vast majority of them are premium. What's your big expense in retirement when it comes to healthcare? Is it that co-insurance or deductible? No, it's your premiums. You can use this account and any qualified tax dependent. So think about your federal income tax return. Who are you taking as an exemption on your return? It's yourself, spouse. You have children who are still tax dependents. Like my 25-year-old's on my health insurance, but he's not a tax dependent. So it's who's a tax dependent that you can use it on. Maybe it's a parent. Maybe your parents are your tax dependents. You're responsible for them financially. You can use it on them. So there's basically 3 different plan documents you can use. Think about it as vehicles. So for us as an organization, from 2004 to 2012, all we did were VEBAs. So you can use a 501c9 trust. The second mechanism is a 115 trust, and we've primarily been using those exclusively since 2012. And then there's also a health savings account. Anybody have an HSA? I love my HSA except for my Tesla stock in it. Should have sold it. That was my fault. It's coming back. If you could focus on that a little bit. So what's a VEBA? A VEBA stands for Voluntary Employee Beneficiary Association. These things are almost 100 years old. We've been in a lot of meetings over the years where we've had people say, geez, this thing can't be legal. It's 100 years old almost. So they've been around since 1928. The money goes in all tax-free. It grows tax-free, comes out tax-free. You can use it for your co-pays, deductibles, dental, vision, chiropractic. The problem with the VEBA is if you die without a tax dependent, the money's gone. And I'm going to go through that in a little bit of detail. And then also, depending on the vendor you work with, some VEBAs have a 1 or 2 bucket approach, and we can go into those weeds. The other plan is a 115 trust. A 115 trust is basically a VEBA on steroids. It does everything a VEBA does. The big advantage of the 115 trust is depending on the vendor, if you die without a tax dependent, you can leave it to somebody. You can leave it to a named beneficiary. And so let's go through that. If you pass away and you have a 501c9 trust, a VEBA, our VEBA Nationwide's PEP, security benefits product, if something happens to you, your account gets retitled in your survivor's name, your spouse's name. So when Brian Filippi passed away out of Chicago Heights, his account got retitled in Judith's name. She has the rest of her life to use that money completely tax exempt for herself and any of their tax dependents, okay? The problem with the VEBA is if you die without a tax dependent, the money reverts back to the trust and gets divvied up among the active members of the trust. So when Joe Matchett in Naperville passed away, they had a VEBA with us back in the early 2012s, 2013s. When he passed, the money reverted back to the trust, all the members of the FOP bargaining, and got a piece of his money. Okay, it's just the way VEBAs work. With a 115 trust, you die with a tax dependent, the account gets retitled in your survivor's name. Just like Brian Filippi went to his wife, same deal. If you die without a tax dependent, what we figured out, and it took us a fair amount of time, it took us about 8 years, is that you can leave it to a named beneficiary. So you can leave it to your grown children, you can leave it to your nieces and nephews. Okay? And so there's some advantages to the 115 trust, and for us, all we've been using since about 2012 is this 115 trust. There are 115 trusts from certain vendors out there that if you die without a tax dependent, the money reverts back to the employer gets to keep your dough. And we've seen that happen. Okay? So you just need to ask the question depending upon your vendor. HSAs. Here's what comes up with HSAs. Can I use my HSA to pay for health insurance premiums? And the answer is no, unless it falls under 3 conditions. One is if the high deductible health plan is part of COBRA continuation. Can anybody tell me when you go to retire, do you go on COBRA? No, great job. The answer is no. It's a special act in the Illinois Constitution. It's not COBRA. So if you have an HSA and you retired prior to 65, you cannot use your HSA on premium. Is your deductible the big expense? Or is it your premium? It's your premiums. If the HSA owner is currently receiving unemployment, your pension is not unemployment, it's a pension. And then finally, if you are 65, if you're 65 and have a health savings account, so like me, my HSA, in 5 years, when I'm 65, I can start using that to pay my premiums. I can use it on Medicare. okay? But that's the time you can use your health savings account for those types of expenses. This was a big change that came about in 2014. When you start up a plan, the members of the bargaining unit or the eligible class are afforded a one-time opportunity to opt out. And so the typical plan that we're doing, the unions agreed to put it in. Let's Oak Forest Public Works. That's probably going to be our most recent plan. They're settled on a funding agreement. They're going to offer every existing members of Public Works an opportunity to opt out. All future members are mandatorily covered. Okay? So it's a great addition for the people who go, I want nothing to do with this. I don't want this thing inflicted upon me. It was a great little thing they did. How are these plans funded? The bulk of our plans are employee contributions. It's the employees giving up some wages. 1, 2, 5, 10, whatever percentage of pay that goes into it. It can be a flat dollar percentage of pay. It can be sick time, comp time, bonus, longevity. Any form of compensation can go into these. It can even be an employer contribution. And we're going to talk about using it as a recruiting retention tool. Does anybody here accumulate large sick day banks and get paid out on sick day banks? Few people? Yeah. So we were in a meeting in Addison Fire Protection District within the bowling alley in Addison. And we were talking about these large sick day banks, and I had some 46-year-old yelling at me going, when I started, I was told never ever to use a sick day by an old gray hair because I got a really, really big check on the way out the door. And I flippantly, I'm a little ready, shoot aim, and I flippantly go, God, that's the dumbest thing I've ever heard. So let's put some math behind this. So you would never lend a friend money for 3% taxable interest. What's wage inflation over a career? What does it average? Right now it's much better because inflation was terrible. What do wages on average increase? 3, is that a fair number? 3.5? Okay, 3.5. You would never lend a friend money for 3.5% interest, but yet you do it with your employer, and your employer is not your friend. And so what's going to grow faster? Your wages through wage inflation or your investment account? I know the investment account's a tough sell right now with what's going on, but historically, investments are going to do better. As a pension trustee, you know better that you're invested, okay? So here was the scenario. 46-year-old retiring in 9 years. 3% wage inflation, 2,880 hours worked a year. They get 12 hours a month or 144 hours a month that goes into a sick day bank. His current balance was 2,497 hours. Wage rate at the time was $41.17 an hour, so a little pre-COVID. So it's been a few years. 8% rate of return on the money. He was retiring in 9 years, excuse me, and responsible for 100% of their health insurance premiums upon separation of service, retirement. They ended up settling the contract, and he took advantage of this. So $92,000 goes in. Now, they have light duty. So this example may or may not work, but it's easily modified. So the district has light duty. So they capped the sick day bank at 300. It's an incredibly low number, I know it, but humor me with the example. So 2,200 hours goes in, it's basically 92,000. Let's say Fantasy Island land, this person never uses another sick day in his 9 years. So 300 hours goes in, he separates service, the 144 hours goes in, the 300 bank and the final 144 go in when he retires, and at retirement, 9 years, assuming an 8% rate of return, he has $292,000. Not too shabby. This was his game plan. His game plan was to never use a sick day, work 9 more years, and accumulate 3,940 hours. Again, Fantasy Island, the probability is pretty slim he'd actually make it there, but let's give him the benefit of the doubt. He were to receive, so I took the $41.17 an hour wage rate, inflated it by the 3%, he would receive a gross check of $193,000. So on the day that he walks out the door, he's at the highest tax rate he's ever going to be because he's making more money than ever, and then he gets a $193,000 check. So he nets $134,000 because he owes $58,842 in taxes on that payout. So let's walk through the math. Which is better? The $134,000 goes into an investment account. He's paying his premiums every month. It's making money. The $134,000 generates about $150,000 a lifetime benefit. This is what he was yelling at me about. Instead, my solution, using the retirement healthcare funding plan, was that $292 generates $420,000 a lifetime benefit. It pays him 9.17 years, 110 months of healthcare coverage versus 45. Same bank, same money. It's a $270,000 advantage. It helps the employer too, because the district was thrilled to get that liability off the books. They were thrilled to pay it out in today's wage rate and also pay it out without Medicare taxes, pay it all tax-free. So here's some examples of how we've been doing some plans lately. A lot of our plans are being done by percentage of pay. And what I would tell you is that you start simple, because we see organizations that try to build the perfect, and it gets all derailed and screwed up and it never gets off the ground. And so I'm going to give you some examples. And then if you look at the bottom right-hand corner, we see pieces added to it over time, and I can thank Richard Sims from Kankakee for the unused uniform allowance in the bottom right. It was his idea, hey, if you don't use your uniform allowance, it goes into your account. Sharp, just very smart. So when we first started doing these plans in 2004, they were end of career only. You were getting a big check and you might as well take it tax-free because you're spending on healthcare anyway. And then we've seen organizations and bargaining units and management teams look to expand them as time goes on. And so it just gives you an idea. You can do it by rank or job title. There's another way of doing it. Further breakdown of what I just went through. You know, chief, fire chief's a class of 1. What do you want to do? How many deputies are there? Same on the police side. Easy to do. So then, this is Hoffman Estates Fire. So the bargaining unit did it by years of service, which again is a common way of doing it. And you could see that the group of 28 years plus were very interested in slamming a bunch of money into the plan in a short period of time. Now they've modified this plan since. They're now in year 4. But this is how they started it. It was done by simply years of service. Then they added these 3 other buckets. The Village of Hoffman Estates gives you a bonus for opting out of the health insurance. So they decided that 50% of that cash bonus would go into your account. The other 50% got paid in cash. All time due as of 12/31 is deposited, so it's not optional. The time due must go in. It's formula driven. The member cannot have a choice. It could be that 75% of the time due goes in. It just has to be formula driven. And those things can change over time. And 100% of sick leave usage incentive. So if you didn't use all your sick days, you got a bonus. That usage incentive gets put into the plan. This is Shaler Township, Pennsylvania. It's a suburb of Pittsburgh. They're like a lot of entities. They're struggling like crazy to hire police officers. And when they find a way to hire somebody, they pay to train them, get them some experience. The city of Pittsburgh comes, taps them on the shoulder and says, hey, we'll give you $7,500 to move, to come over here, 2 miles down the road. And so the employer came forward and decided with the bargaining unit that they were going to give every officer $1,500 a year. And they put a 5-year vesting schedule on it. So if an officer came and left and didn't satisfy the 5-year service requirement, the employer got all that money back. And on top of that, the employers are also contributing about $100 a month, about $50 a check. So it's a recruiting retention tool. It's just a different way to start utilizing and thinking about these plans. We're seeing more and more entities look to reduce their sick day bank. It's a win for the employer. It's a win for the member. Pick a number that works for you. When we first started doing these, we'd see sick day banks at $2,880. Now they're down to $1,440. Now maybe $1,080 or $920 or $720. And they've been slowly buying them down over time because money's better off in an investment account in your name that you control than sitting in a fictitious bank at your employer. Oh, they also do 3% of salary in this one. Simple. Schiller Park Fire. This is how they started it. So nothing complex. 3% of salary. So for the average member of that bargaining unit, it was like $68 a check was the net impact on their paycheck. And then if you separated the service, 100% of the end of career pay went in. And then we have many bargaining units that modify that end of career pay annually. So in 2007, we got approval from the IRS to do such. And so Chicago Heights Fire It's a percentage of pay plus all your end of career pay. So from 2007 to 2015, Frank Enright, the union president, would say to his membership in the November meeting, who may retire this year? And so during that entire period of time, they decided that it was 100% end of career pay, would mandatorily go in. In November of 2015, at the union meeting, he asked his membership the same question, 3 hands go up that I may retire. He says to those 3 people, what do you 3 want to have happen? And come up with something that you want, otherwise I'm going to call for a vote for what I want. So 2 of the 3 wanted all the money to go in. The other guy said, I'm moving to Tennessee, I want my cash. And so the 3 of them decided that if you separated service in the year 2016, half of that end of career pay went in, the other half got paid out in cash. They voted, wrote up the MOU, sent it to Mayor Gonzalez, called it a day. Later the next year, they rolled it back to 100%. It's been that way ever since. Wish I could take credit for this. Tier 2. So we're having Tier 2 people now above the pension limit. And they're hitting that in October, November, December. So what they decided to do, and I have to thank an attorney for this who came up with the idea, is the member, if they're a firefighter, still contributing to 9.455, or the police officers contributing to 9.91, instead of it going into the pension when they've hit their cap, it goes into the retirement healthcare funding account. So they're used to already making that contribution. Now it goes into account for their own retirement. And then they negotiated a 50 cent on the dollar match. Pretty cool. Nice way of thinking and doing things. This was a group of not all represented. This was a park district. It took about a year of education, but they did it by years of service in IMRF, plus end of career pay, and then they carved out the department heads. It looks, feels, and tastes like a deferred comp plan. The money goes into a mutual fund, you get to control it. It looks just like your deferred comp at the end of the day. There's a portfolio of funds. There's a stable value account most vendors have. There's also a managed account that vendors allow you the opportunity to have. This is one of these rare win-wins. It will reduce overtime and sick time abuse, especially when people start hitting their caps in their banks. We all know what people do. I wouldn't leave money on the table. I don't understand why anybody else does. I'd rather go catch a Cubs game. Sorry for non-Cub fans. So it's a win-win. The employer sees a reduction in the use of overtime, the reduction in the abuse of sick time banks. The employer saves all the payroll taxes. So the Medicare and Social Security match, if applicable, you save that money as the employee saves it as well. Think about it as a flexible spending account without the use it or lose it clause. And then, again, discourages the abuse of sick time, reduces overtime, payroll taxes, sick day banks, this thing called OPEB, which is a liability. And the idea is to position your stakeholders, your stakeholders to retire when they would like to retire instead of hanging on because they're not prepared for health care. The vendor will give you contract language, plan documents, and the resolutions needed to adopt. And I am done. Questions? Anything? Yes, sir. The question is can you convert an existing VEBA into a 115? The answer, truthfully, is I'm unsure. We found a private letter ruling that allowed such a thing. The problem with the private letter ruling is the private letter ruling is only applicable for the plan that asked for it. So you could extrapolate out that it should be okay. It's one tax-exempt bucket for another tax-exempt bucket, and they're a unit of government, they're exempt from taxes anyway. So it depends on the lawyer you would talk to. Any other questions? Yes? So the question is, how do you go about doing the different groups and changing the groups and technically the mechanism to make it work? Did I get that right? Okay, thank you. So there's different ways of doing it, but most of the time it's done at contract renewal where they're changing maybe the years of service. We have seen done that where they may combine some ranks. We do see some plans that change annually if the employer will allow it. It tends to get a little cumbersome on the municipal side that they don't want to deal with it. But basically, the union would sit down, hammer out amongst themselves how they would like the different groups to look. The problem is that you can't have a plan that you choose like 0, 2, 5, and 10% of salary, and you choose which group you're in. It has to be formula driven where it doesn't appear that you have a choice on what you're doing. But we see groups, some plans are changed every year. Most plans are changed at contract renewal is what we see. It's just a matter of people working it out within the group. Pardon me? Non-contractual, it's done by policy. So if it's done by, so thank you. So non-contractual, it's done by policy. So we would prefer that the policy is not done in the same calendar year. So you make changes for this year now, effective for 2026. Did that help you? Thank you.